Hello, we're Team 8 and we're working on the trauma activation algorithm capstone with the Phoenix Children's Hospital. The primary purpose of our project is to design an algorithm to optimize the classification criteria for injured children. So they have different trauma levels for different injury severities. Level 1 is the most severe, and level 2 is still pretty severe but not as serious. For level 1 patients, they require a large team of professional emergency doctors. And this, while it is certainly capable of saving lives, is also a waste of resources if the patient does not need it. So our goal is to correctly classify the patients and decide if their injuries are severe enough to be in level 1 or level 2. The current algorithm has an over triage rate of 50%, which means that about half of the patients are overtreated. This is done because there's no algorithm really in place at the moment, and it's better to be safe when it comes to lives. And our entire goal is to just reduce the over triage rate and try to bring it down to about 30%. So in phase 1, we're mainly just learning about the medical jargon and trying to understand all of the different acronyms and whatnot in the data, and also going through the existing algorithms. In phase 2, we're going to look at all of the different data, preparing it, cleaning it, getting rid of any like nulls and duplicates, and then splitting up into pre and post conditions. So if we go here to the Excel file, so the green are the preconditions. So these are the conditions that we know about before the child is actually in the hospital. So for example, the age, the gender, the injury code, and then the pink columns over here are the post conditions that are identified after they're admitted. So, for example, their systolic blood pressure, their respiratory rate, Glasgow coma score, and then how long they were in the hospital, as well as many other fields. And this is the data that we started off with initially. As you can see, there are many blanks that we had to clean out in the refined data, and there are so many columns. We really didn't know which was pre and post before, so we had to communicate with the sponsor and identify all of these columns over here. So going back to the PowerPoint, phase 3, we had to find the correlation between the different factors and determine which variables were like independent and which were dependent. Okay, so here I will start off with the fall analysis. So we have different print statements and counters for different levels. And for example, level 1 patients that have penetration, level 2, level 3, and so on. And we have this for different columns. So blunt trauma, fall height, etc. And if we run this, we will have a little diagram as well as text below, and we can see the number of patients that had that belonged to like each trauma category that had specific fall heights. So for example, blue is less than 6, and you can see that most of the patients that had a fall height less than 6 were level 3, which is not as severe. A few of them had fall heights greater than 15, but mainly level 1 patients had fall heights between 6 to 15. And if we go to our other, or one of our other scripts, we can see different patient statistics. So for example, this is just a bunch of correlation matrices. So comparing airbag deployment with trauma level, movement speed with trauma level, etc. And then down below we also have different pre and post conditions that are being compared, such as physical abuse with trauma type. And if we run this, again, we'll have data analysis here as well as diagrams, and we can see in this correlation matrix, so a 1 is one increase in one area directly corresponds to another. So if the variables are the same, for example, we'll always have a ratio of 1. Here we can see that a front deploy airbag is not really related to level 1 or level 2, but it is more often to be level 2 than level 1. Okay, going back. So we also classify the data into different subcategories depending on the accidents to find out what tends to cause them to be level 1 or level 2, which fields are the most important. And here we have a fairly large report with different subcategories. So motor vehicle accidents, a bunch of statistics here. So for example, 8 out of 101 patients were given level 1 treatment if their shock rate is less than 0.75. Similarly, we have systolic blood pressure and respiratory rate analysis, injury comments, and others. So the work done was divided by each of our team members. You can see here, for example, we mostly all worked on correlation in different fields, and some of us worked on neural networks, others worked more on like document frequency or other fields such as subcategories. Future work involves feature selection, finding out the independent variables, trying to choose an appropriate model for learning algorithm. Currently, we're thinking neural networks or decision trees. Training and testing the model, checking and improving the accuracy, as well as like specificity and other non-functional requirements, optimizing the learning algorithm, and then continuing to optimize it until we meet the sponsor's needs. And that is all. Thank you very much.